Dear students, future Masters of Digital Health, a warm welcome to our study program. It is a great pleasure to welcome you all on this very first day of your MDH journey. My name is Georgi Chaltikyan. I'm head of this study program. I'm professor and head of Master of Digital Health study program here at Deggendorf Institute of Technology, European Campus Rottal-Inn, since 2015, since the establishment of this campus. And I also had the same Master of Digital Health program in my country of origin, in Armenia, since 2022. I'm also a digital health consultant to the World Health Organization. Please feel free to connect with me on LinkedIn and on other social media. I'm relatively active and post quite frequently about our activities and about wider domain of digital health and, of course, artificial intelligence for health. First and foremost, I would like to let you know that you are, ladies and gentlemen, right now at the Germany's first and only up to now World Health Organization collaborating center specifically for digital health and on digital health. We are very proud to have been designated a WHO collaborating center earlier this year in February 2015. And we are actually one of only 7 collaborating centers globally that have digital health in the name. And this underscores our commitment to advancing digital health, not only locally, not only regionally or nationally, but also globally, with the in alignment with the WHO's global program framework priorities. As a WHO collaborating center, we will work closely with the World Health Organization to enhance digital health policies, to develop comprehensive training modules, and to undertake research and assessment of digital health interventions. A few words about your study program. We call it, as you probably noticed already in the title, on the title slide of this presentation, we like to call it I3 or I3 for interdisciplinary, international, and innovative. We are one of the well-established, well-known, and I should say quite demanded postgraduate study programs in digital health, as witnessed by more than 1,800 applications in 2024. We combine theoretical knowledge and practical skills in digital health and in artificial intelligence for health through lectures, seminars, class discussions, case studies, lab trainings, as well as participation in conferences, visits of healthcare providers and companies. Perhaps the most important, the highlight of this study program, of our curriculum, is the so-called project-based learning, uniquely innovative competence building, where you will be engaged in development of real-world digital health and AI solutions. We have had a total of 572 admissions up to now and 225 graduates up until this October, obviously, and the total number of MDH students studying now on our campus is about 170. I'm sure many of you have already had a look at the curriculum. We call this curriculum convergence, mix-up, and divergence. So to say, by convergence, we mean that those of you coming from biomedical domain will get additional training in computer science, while those coming from medicine, from computer science, will get training in fundamentals of medicine. Then the main modules in this and next semester will be attended by all of you, and those are international and global health. This semester, health economy and management. In next semester, we will have digital health fundamentals, digital health technology, digital health applications, digital health information systems, data protection, as well as digital health coding and classification. We will have a special module on research. And of course, later in the third semester, you will also have a very important module on soft skills. Now, what you see in the lower part of this slide is exactly the project-based learning, whereby you will have an opportunity not only to engage in these projects and develop these projects, but to differentiate a little bit between the managerial path in digital health versus software developer or data scientist path. What we think of the graduates of MDH, we like to call our graduates digital health specialists. I will tell you a little bit more about it in the very end of this presentation. And you see here the various career roles that graduates of MDH are expected to take in the wider health sector and in the wider world of health sciences. But first and foremost, please always keep in mind that you are expected to become a leader and the innovator. So innovation and leadership in digital health is the primary goal, or if you wish, a mission of any digital health specialist. And it is you guys who are expected to be the primary drivers of the digital transformation of healthcare. You are going to witness that multiple partnerships of this unit, and specifically related to your study program. First and foremost, as already mentioned, of course, the primary partnership is the WHO Collaborating Center, but we are also partnering with major international and global societies and think tanks in the domain of digital health, such as, for example, HINS, Healthcare Information Management System Society, which is the global largest non-profit, global largest society uniting more than 200,000 digital health professionals from around the world. And we are, then there is also the International Society for Telemedicine and eHealth, the European Federation for Medical Informatics, International Medical Informatics Association. We are very proud and very happy to be an institutional member and partner to all these major societies. And of course, you, as you probably understand, this very significantly affects your learning experience at European Campus of Deggendorf Institute of Technology. Furthermore, we have the collaborative relations with academia partners, such as University of Agder in Norway, Semmelweis, very famous medical university in Budapest, Hungary, or Luleå University of Technology in Sweden, the Czech Tech in Prague. We are partnering with Armenian colleagues through my connection between Armenia and Germany, notably with a university in Armenia where MDH is also established as a double degree program, which, by the way, allows some of you to expand the curriculum and to extend it to additional 30 CTS that each of you can get through specific internship in Armenia, while the MDH here in Germany does not by itself does not have a formal internship. And of course, the leader of main driver of these developments in Armenia is the Armenian Association of Digital Health. We are furthermore very honored to have collaboration with our Bavarian State Ministry for Health Care and Prevention. You will get quite a lot of practical training, both through our DigiHealth lab, as well as through several trips to medical institutions, to healthcare providers. And of course, the most important, perhaps, once again, is the global experience that we truly give our students. The exposure to global community in digital health. And this is indeed one of the main highlights of this study program. You will have a chance to participate in, for example, global conferences such as HIMSS Europe meeting that brings together hundreds of professionals from not only Europe but around the world, or the Europe's largest expo and congress in digital health taking place annually in our federal capital, the city of Berlin. More on all of that, of course, you will be learning as we go. Now, it is my great pleasure to introduce to you also a forum and education platform and an event series of our own that we established right here at European Campus Rottal-Inn of Deggendorf Institute of Technology 5 years ago in 2020. And this is our Global Forum for Education, Research, Innovation and Networking in Digital Health, titled eHealth Day. It is very important that all of you join this eHealth Day community. By following this QR code, you can register, or this QR code, you see the eHealth Day also on my background, because this is perhaps the most important event in digital health and around digital health and around health at all happening at Deggendorf Institute of Technology at European Campus Rottal-Inn. And of course, all of you are most welcome and expected to actively engage and participate in this important event taking place on site and online in November. Apart from eHealth Day, we have been delivering also the so-called blended intensive program on artificial intelligence for health. That is co-funded and supported by the European Union through Erasmus Plus project. And this is another highlight of our activities. We will be hosting this program for the third time this year, and it is a separate intense course that gives 4 additional ECTS in value. And through our collaboration with our international partners, the top experts from around Europe come and deliver training in this program. A few words about important digital health projects that we are engaged in right now. One of them is the project VRMTB, or virtual reality or extended reality for multidisciplinary tumor board meetings. This is a project that started this year and will run for 3 years. And as a result of this project, we are developing a special platform, an application that will allow physicians to engage in an immersive experience during tumor board meetings. Another important project, multinational, major pan-European project that we are an important partner of, is Expanding Innovative Alliance that we call FHIR for short. This is a consortium of 24 partners from 18 countries around Europe. And the goal of this project is all about education and training, development and delivery of training courses on digital health standards and interoperability as a preparation for the so-called European health data space, of which you will be hearing a lot in the next 1.5 to 2 years. Another project is we are also developing an online course named Global Digital Health, which will be launched early next year, sometime in February, March next year. We publish quite actively on the different aspects of digital health. Most importantly, perhaps, and my personal focus of activity is the education, digital health education and training. And in that regard, we recently published also a chapter in this book, Digital Maturity in Hospitals, chapter on strengthening the healthcare workforce to achieve digital maturity or digital transformation. Last but certainly not least, and this should be something to inspire all of you, ladies and gentlemen, we have just launched a global movement towards harmonization, recognition, and accreditation, global accreditation of MDH as an own degree. And we call this an MDH alliance. The objectives of this alliance are to develop a competency-based education framework to harmonize MDH curricula around the world, to create an international accreditation framework, to promote institutional collaboration, and eventually to strengthen the digital health workforce development. The ambition of this major international movement is to achieve the situation when MDH is a recognized degree of its own, similar to what MPH is for public health professionals. So think of it as MDH to be an MPH of digital health specialists. On that, ladies and gentlemen, I thank you once again for choosing European Campus Rottal-Inn, Deggendorf Institute of Technology, as a place for your postgraduate studies. We are honored to have you with us, and we will do everything possible to provide you with an excellent and rewarding education journey. Thank you.